Hi, I'm Gina Salazar. Welcome to the Better Arizona Show. Are you suffering from depression, weight gain, hair loss? A lot of women are experiencing these problems. Today we're joined by Dr. Red with RedRiver Health and Wellness to tell us a little bit more about what may be causing these symptoms. Welcome, Doctor.
Thanks for having me.
Tell us what type of things you're seeing with women specifically.
The biggest thing we work on is patients suffering with low thyroid and other autoimmune diseases, but typically a disease called Hashimoto's. This is an autoimmune disease that will attack the thyroid tissue, and it destroys enough thyroid tissue to where eventually the patient has a low thyroid.
Now, a lot of people think low thyroid, just a quick fix, you take a pill every morning and it's all better. That's not always the case, is it?
Yeah, there's a lot of patients that have thyroid issues that end up having a lot of other symptoms, even with a thyroid hormone. And that's typically because the main thing causing it is totally overlooked and mismanaged. So this is where we differ, to where we go in and we want to look to identify exactly what's causing the low thyroid and not just try to mask the symptoms.
Go through the signs and symptoms that people may be experiencing.
Okay, symptoms will be depression, fatigue, inability to lose weight, hair loss, brain fog. Once they have Hashimoto's, they'll end up having anxiety, restlessness, swelling, intestinal issues, things like that.
Wow. Now, a lot of people have these types of problems, but they've been told in the past that it's not their thyroid. And so they kind of get stuck in this cycle of trying to find an answer. They know that they don't feel good and the doctors keep telling them, all your tests look great. What do you tell those patients?
In those cases, you have to test for certain things. You can't just do a regular test and think you're fine. You have to dig deeper and try to find out the underlying issues that are really causing this patient's symptoms. And usually, if you can go in and really analyze the blood chemistry in great detail and do the right tests, it comes back that the patient actually isn't crazy, that they do have lots of other things going on with them, It's funny, but literally we'll have patients come into our office day after day where they think they're crazy, everyone else thinks they're crazy, and really they're not crazy, they're just totally mismanaged, and you just have to find the mechanisms causing the problem.
Now, you were telling me specifically about one of your patients, Rebecca. Tell me what type of a transformation you've been able to make for her.
Yeah, a lot of patients that see us will end up having anywhere from 0 to 5 good days a month where they actually feel great and they feel like they can function and do well. In Rebecca's case, she was one of those where she just didn't feel well at all, and she went to multiple doctors. She was on thyroid hormone, she was on cortisol, she was on all these different little medications, not feeling well, and she could barely even function. And one day her son brought home a picture of her, and it was her in bed. And she said that she looked at that and was like, oh, what's this picture? And he says, that's you, Mommy, because you're always in bed. From that point, she knew she just had to change and knew that, there had to be a better solution. And then she ended up seeing us, and now she went from 0 to 5 good days. Now she has close to 25 good days. And she's able to work out again, and she's able to function better. She's lost quite a bit of weight, and her life is drastically different. In these cases, though, you can't cure this. This is something that you're going to have for the rest of your life. But what you can do is get things function better and then also teach them so that they can eventually be the expert in their own health. They can be empowered and have control of their condition, which is a big thing for us,
That's wonderful. Well, we are really lucky to have you here, and thank you for sharing all of this great information. You've got a special offer for our viewers, too.
Yeah, they can come in for a free consultation. They can also download a free brochure on our website to look more into low thyroid and autoimmune diseases and all that as well.
Wonderful. Well, that website is lowthyroid101.com, or you can call them at their office here, 480-970-5555. Dr. Red, thank you so much for being here today.
Hey, thanks for having us.
The Better Arizona Show will be right back.